Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Oh, this is an interesting. I don't know how many people in this call have diabetes, but this marks 100 years since insulin was introduced to the public. And that is a momentous milestone because it really turned around the fact that diabetes was killing people all the time. It still is, but now with insulin, you can treat diabetes and prevent some of the many complications of diabetes. And it's an unending number of issues that diabetes, the complications of diabetes manifests itself, not only with heart attacks, but strokes and with kidney disease. And so it's wonderful that God's given us the knowledge to develop things like insulin. And that is interesting when we talk about developing insulin. Insulin has always been around. It's our identifying it and making it, producing it in a fashion that can be used for everybody. That makes it so revolutionary. And over the last 100 years, we've had many other exciting developments in which we've identified ways to overcome illnesses. And as we appreciate that this is 100th anniversary, it's a good time to be reminded of the other things that are important, such as meditation, exercise, and an appropriate diet. I think we've talked many times and been reinforced by Daryl about the importance of eating the right foods and decreasing our love for salt and sugar and meat, so red meat, so that we have to take all these things into consideration and appreciate how blessed we are that we are able to be alive in this century. Not to speak of all the things that are developed with transplantation, and so it goes.
Dr. Callender, I think I remember maybe, I don't know, 30 or 40 years ago, they were using horses and maybe pigs to get insulin. So were those...
Now we use human insulin.
Were those forms of insulin compatible with humans? I mean, insulin is insulin, period.
Yes. Yeah, we were able to, yeah, the first ones were pig induced, and yes, but I think the best is the humanized insulin, and with monoclonal antibodies, we're able to make it humanized, which is thought to be safer than the other ones. And so that's why we use more of that today. But you're right, we start off using pigs and then got to the point that we now have humanized insulin. And I think one of the, this is an interesting article that and if you go to the link, you find his whole story. But basically, he's the only African American who's received a face transplant. We talked about composite tissue allotransplantation with face and face and arms, legs, hands, larynx, and many other parts, including the penis and the uterus, giving live births from uterine transplants. but he's the only African American who's had a face transplant, and the face transplant requires a special permission, as do the face, the arms, and the penis and the uterus as well. But he's 4 years now after having his face transplant, and he gives all praise to God for his blessings. And so he's actually, this article that he has, this talks about his life story and how he went from being burned in an automobile accident, and how his life was saved, and how face transplant has opened the door for him to praise God for all of his blessings. So it's what is different about the face transplant and the composite vascular allotransplants is that you have to have a special permission. So signing a donor card is not enough for these specialized transplants. For them, you have to have an additional consent for the donation and for the recipient. Okay, but I thought it was nice to show his picture and point it out. Now, this is an article that talks about uh, how exercise plays a role even in people who have strokes to help stave off dementia. We talked before about the many things that we can do, including the puzzles and other things we can do. But sometimes we forget about one of the most important aspects of it. Also is exercise, and we've talked ad nauseum about the fact that exercise of 30 minutes a day, 150 minutes a week is the minimum of what you need to do to have exercise play a role in your health care. And all of the data now is identifying not only is it good for your cardiovascular health, but it's good for your brain. And I think we're having more and more studies, randomized control studies, that are demonstrating that exercise is healthy, allows for good health, and also decreases the likelihood of dementia. So I think that's something that we are aware of, but sometimes we need reinforcements to remind us how important exercise is. And the other thing that later on we'll show is that sometimes all of the exercise can be undone if we don't get proper sleep as well. So, and the brain plays a role in this as well. So, any questions about the impact of exercise on the brain and the fact that they are related? Of course, when you think about it, all of the systems are related one way or another, and this just identifies the data that supports the fact that exercise and brain function are related.
Dr. Callender, I got a question about the brain function. The brain functions, cognition is improved with exercise. But isn't the brain also a muscle?
No, brain is not a muscle.
Thanks for clearing that up.
Yeah, the heart is a muscle. We have many muscles, but the brain is not a muscle. Yeah. Brain is it's primarily made of neural complexes. It is really an extension of the nervous system, or the spine is an extension of the brain, and it's yeah. But
Uh,
yes, Daryl.
I've got something from WebMD that says sex counts as exercise. Sex is really a great form of exercise. It won't replace the treadmill, but it counts for something. Sex uses about 5 calories per minute, 4 more calories than watching TV. It gives you a 1-2 punch. It bumps up your heart rate and uses various muscles. And of course, the longer you go, the more exercise you get.
Thank you very much.
You're welcome.
Uh, it's interesting that it's a great exercise, and for some, it's a terminal exercise. We have some people who actually gone to paradise after exercise, and some would argue there's no better way to go than that. But uh, it's it's a very good point that sex is a great exercise. Now, this article points out that even there are people who said that they don't want to exercise every day; they just want to exercise on weekends. And this data supports this and indicates that as long as you put in the time, and we're talking about 150 minutes, whether you do it on the weekend or whether you do it every day, it doesn't matter. The results are still the same with a reduction in atrial fibrillation, which means the heart is not beating normally, and sometimes as a consequence, you get blood clots, and you have difficulty in the heart being synchronized with the rest of the cardiac apparatus. So atrial fibrillation, myocardial infarct, stroke, and heart failure are both uh, improved by exercise. Uh, and I think that there's a little question that exercise is important, but it also points out there's more than one way to skin a cat. You can do it daily for 30 minutes, or you can do it over the weekend, as long as you get the 150 minutes in. Apparently, the benefit is still there because they looked at both groups, and there's a table that points out that results were similar in all groups. So, and the atrial fibrillation that's what AF is for, myocardial infarction, heart failure, and stroke. Yeah, and so that's an interesting finding. I don't know how many of you do the exercise daily or do the exercise over a weekend. But anyway, this is for those who are the article is called The Weekend Warriors. Any comment about that, or any thoughts? But I do the old-fashioned way of about an hour and a half. Actually, I try. I actually do it 7 days a week, although it's only recommended for 5 days. Yeah, but remember, the 150 is the minimum. So going in excess of that is okay. It's just that that's the least you should do.
Now, I do about an hour and 45 minutes 3 times a week
Great.
swimming.
Daryl, any comment?
Yeah, I'm a 3 timer weeker uh, with mixing it up with cardio, weights, and stretching.
That's the ideal to have the combination of the weightlifting as well as the aerobic exercise. As a matter of fact, that is the ideal to mix it up with the weightlifting. Uh, Now, this is another article. It seems like we have a lot of articles on exercise, but that's as it should be. Just as we had a lot of articles in the past on dietary and dietary discussions and the proper nutrition. it pays for us to recognize that this article shows that not only does it affect the brain and other parts of the body, but it also decreases the risk of depression, which of course is one of the anxiety and depression are we have actually epidemic of that across the United States, leading to the fact that we have obesity and overweight as a problem. Now, depression and anxiety, we know, are related to suicide and other unhealthy mental attitudes. And for the most part, if you don't have good mental health, you don't have good health. And so uh, the fact that this helps depression is an important finding. And because of the pandemic, we have more anxiety and more depression than ever before. Any comments on this? If not, we'll do the next one. Now, this is somewhat discouraging in the fact that there's so many people who don't get the prescribed 6 to 8 hours a night. But poor sleep does reduce the cognitive benefits of exercises. And we all know that dementia, the older we get, the more dementia becomes an issue. And so proper sleep as well as exercise become important to protect against cognitive decline, which older you get, the more likely you are to have cognitive decline. So it's suggesting that combination of sleep, proper sleep, and physical activity are very important. Now, they looked at 8,000 participants, which is significant, who aged at least 50 years at baseline. And their studies, again, remembering that often these studies don't have a sufficient amount of people of color, but still studies nonetheless that identified that the optimal sleep and exercise are important to overcome the rate of cognitive decline that occurs as we age. And the older you get, the more likely you are to have the cognitive decline. So it's good for us to do as many of the things that we can to maintain the proper balance of nutrition, exercise, and sleep. But that's easier said than done. But because some people have difficulty with sleep, and one of the things that Evan said 2 weeks ago was that if you have trouble with sleep, you probably need to see a sleep expert, because they are psychologists who are actually sleep experts. So this is just another way as we talk about how we can optimize our health and stay healthy. Any comments about that or different perspectives on that? Okay. Now this is an article that points to the fact that something that we haven't talked about recently, but the fact that diagnosis errors contribute to 800,000 harms and deaths annually. And they involve blood vessels infection and cancer diagnosis and other issues. And so what is the take home with this? This is something that has been reported over the last 10 years to point out that doctors make mistakes. and sometimes these mistakes result in people dying, and that is why it's so important. If you have any question about what is occurring to you, that you get a second opinion, and also that you also give all of the information to your doctor so they can make the right diagnosis. And the issue of misdiagnosis is something that some people think will be helped by artificial intelligence. I think it'll be helped by doctors and patients communicating effectively and in all ways, and the doctor being straightforward and honest with the patient, and the patient being straightforward and honest with the doctor. There's so many diseases and so many events, and of course, malpractice insurance claims also occur because of misdiagnosis. Misvascular events and infections also are as lethal as anything else. And there's so many ways that illness can present itself. Blood clots, infections, and then of course we look to the John Tatum and his recent heart attack diagnosis, in which he went to the doctor immediately, and that is so important. But of all the things that is important, I think you can't underestimate the importance of effective communication between the doctor and the patient, and which means that the doctor has to exercise his ability to his best, and the patient has to give them all the facts. And often that requires the patient to have an advocate with him, whether it's the significant other or another person, so that they can feel comfortable to give all the information and ensure that there's effective communication between the doctor and the patient, so that we can minimize the likelihood of misdiagnosis.
That's an important point, Dr. Callender, for those that may not have another person or a significant other to help them with these things. Do hospitals now have people that can serve in that capacity?
No, for the most part, the answer is no. And this is an area that still is open to improvement. Majority of patients that I see don't have a significant other with them, and as we talked about it, there are many instances in which the patient comes and gets the information, and once they receive the diagnosis, they just lose contact with the doctor, and they don't hear another word for the rest of the conversation, and that is dangerous, and that's why your point is well taken, that that's an issue that everybody doesn't have a family, everybody doesn't have a significant other, and what are ways of overcoming that? Well,
patient advocacy, right? Patient advocates.
Yeah, well, the patient advocate can be a friend or it can be a relative, but many times patients don't have an advocates, and that is one of the issues that results in ineffective communication between the doctor and the patient. And just like we talk about navigators for the patient to get through the system, which is critical, it's equally important for the patient to have an advocate.
There's a Society to Improve Diagnosis in Medicine, and their website is improveddiagnosis.org. and it says if you're a patient of color, especially if you're of African ancestry, your chances of misdiagnosis are greater than white patients, and you have higher odds of suffering greater harm from diagnostic errors than they do.
Good point. Good point.
Dr.
Dr.
Callender, how
Callender,
important are the patient portals that the some of the doctors are using now? Because I know with my doctors, they put my evaluations out there and their comments about my visits to their office. Is that a means for patients to share that information with others to
Well,
keep
that's
others informed?
well, that is an interesting point you raised because one of the new rules is the HIPAA regulation, which makes it illegal to share patient information without their permission, so that the doctors can't do it. But if you choose to do it, that's up to you. But it's illegal actually to share your private information. And if you violate that rule, there are penalties, including financial penalties, and actually you can actually go to jail. So in many ways, the HIPAA action prevents us from sharing, but it doesn't prevent you from sharing if you want to.
Dr. Callender, I've heard of situations where doctors think that a person's illness is psychosomatic. In other words, it's really nothing there, but the person feels in their head that they are having a serious problem. Um, have you ever heard of those kinds of incidents?
Oh yeah, but I also recognize we wrote a paper on the subject that if you think you're sick, you probably are. And there are many studies that have demonstrated that yes, there are psychosomatic illnesses. But what that means is that the anxiety that you have has made you sick. And so we have to be able to deal with that as well. And so that one of the ways of dealing with that is to have have us actually be seen by a psychiatrist or a psychologist and have that dealt with because we cannot find out why you are sick does not mean that you're not sick. And if it is psychosomatic, then we need to be able to deal with the anxiety that is producing that disease entity. So I take it all very seriously, and I consider psychosomatic illness as a significant issue. But I think that its remedy is just as serious.
Dr. Callender, is there any effort to increase patient advocacy?
Well, no. For the most part, one of the problems is that that really has to be done by the patient uh, because of HIPAA, in the sense that I think what has been done is the patient navigators that help the patients get through the system. Uh, but we have not done as much with patient advocacy as as we might be able to. And one of the drawbacks is the extent to which we can communicate your particular issues without your permission. But there is a great need for patient advocacy, and there are advocacy groups. Uh, but they require, for the most part, the patient to recognize that he needs the advocacy, he or she needs the advocacy, and then to uh, take advantage of those people who are available to do it, because there are, as you mentioned, patient advocacy groups that are willing to work with patients. But for the most part, right now, we haven't taken that bold step forward to work in greater detail with patient advocacy groups. And that may be the very next step that needs to be emphasized. I think you're emphasizing a very important point, the need for patient advocacy, because everybody doesn't have friends, everybody doesn't have relatives, and so what do? when they want to go see the doctor. And most of them go alone. And that is not really a safe practice, but it's something that is food for thought and does require us to re-emphasize, as you are re-emphasizing the importance of patient advocacy. Any other comment on that? Very important point. Now this is yeah, go ahead. Somebody,
Yeah, Dr. Callender, I've talked to some people that have gone to the doctors or whatever, and when they get that diagnosis, their mind just blanks out because
right.
they're just thinking of like what's going to entail the rest of my life, and that it is always benefit to have someone with them, because then they can pick up from there and say, well, this is what the doctor said after you started blanking out.
Right, right, and of course, it also requires sensitivity on the part of the physician to recognize that and to try to support the patient. I'll never forget what Pearline Freeman said some time ago, that when she had her diagnosis made, that her doctor was so emotional with it that she tried to help him, and in helping him, helped herself. So
Right.
So the importance of what you said cannot be lost and must be emphasized, because the need for patient advocacy is great. Now, with this epidemic of early onset colorectal cancer in men, it becomes very important to realize that it is a problem for men under 50. And we've had cases who are actually in the 30 age group. And so this occasioned them to identify some of the 7 factors associated. And it goes through old age within 35 to 49-year-old age group, no regular use of aspirin or ibuprofen, no regular use of statins, current alcohol use, family history, colorectal cancer, high disease burden of colorectal diseases, and socioeconomic, the social determinants of health certainly play a role, because if you don't have access to the healthcare system, that puts you at an increased risk of this kind of problem. This is an issue for colorectal cancer. It can be also an issue for breast cancer in women. But it's just observed that when they first started this effort, it was for those in the age group of over 50. But with people of color, those age groups need to be much lower. And so this is an effort to try and sensitize people who are under 50 of the fact that there's an alarming increase in the number of people who develop colorectal cancer who are under 50. And so we need to be more sensitive to that. And that means that they should be screened at an earlier age. We have too many people that we know of who have died from cancer who were well below the age of 40. And so we have to be sure that they are screened as well as those who are over 50. This is important for your children and your grandchildren, to let them know that when they reach the ages of 35 and above, that they need to be screened for these diseases.
Here's something from Cleveland Clinic. It says they did a study that found men who ate the most amount of ultra-processed foods had a 29% higher risk of developing colorectal cancer when compared to men who ate the least amount. And the study did not find the same association in women, and it's unclear why.
And I think that's the one thing that is not, as a factor that is not listed here, is red meat. And to me, it should be. But I thank you very much for bringing that point to bear, and the fact that it affects men more than women, and yes, we don't know why. It makes you think that estrogen is protective, though.
Yeah, Dr. Callender, when I was, I think, about 26 years old, I had a positive colorectal test, and they said to stop all red meat, which I did for about 5 or 6 years. Um, I do eat a little bit, no beef really at all nowadays, but I haven't had a positive test since then. So that was
What was the positive test?
the colorectal blood in the stool.
Oh, I see. Okay.
Yeah, blood in the stool. They had you test your
Did you have a colonoscopy?
at that point I had not had one, but years later I did.
Okay. All right. Okay.
Mhm.
Any other comments? Now, this is, we had a particular presentation on constipation. And I think one of the important things to take back from that, even though constipation is linked to cognitive decline, is the importance of fiber-rich foods. You can do a lot of other things, but fiber-rich foods really make a difference in terms of whether you have constipation or not. And your diet is probably the number one factor. Number two is exercise, but fiber-rich foods is probably underestimated in terms of this. And I think Darrell has pointed that out time after time. We didn't appreciate the fact that this was associated with an increased dementia risk. And so, and of course, the concern about the makeup of the intestinal bacteria, the microbe, is something that is also under recognized and underappreciated. But I think that we have to recognize that if there was one thing that is strongly associated with constipation, it's lack of fiber. And those people who don't have daily bowel movements certainly are. And then, of course, some would argue that the buildup of toxins as a consequence of the bowel content not being eliminated on a daily basis. Some people think you should have bowel movements at least 3 times a day, some two, but nobody thinks you should have bowel movements less often than every other day. But I think the one thing we tend not to talk about is the buildup of toxins as a consequence of not moving your bowels on a daily basis, and whether this contributes to Alzheimer's disease or not remains in the microbiome of the gut. It's something that is discussed, but I think what lends itself to its correction is the presence or absence of fiber-rich foods. And any comment about this? Because constipation is experienced in our age group more than any other age group, people over 60. And this talks about the butyrate as a bacterial byproduct of the stool staying in the GI tract for long periods of time. And whether the medication that people take to affect the healthy gut microbiome or not remains to be seen. Exercise, sufficient sleep, and a proper diet really is important to prevent constipation and promote brain health as well.
Dr. Callender, I guess over the last, I don't know, 5 or 6 years, maybe more, those over-the-counter uh, treatments or whatever that supposedly correct your gut bacteria. I forget what do you call them? Somebody knows.
Oh, you mean the
Probiotics.
yeah,
Probiotics.
probiotics. You're right. Yeah.
Is that stuff any good?
There's mixed data on that. Actually, I take them, but the data is not profound. There's a lot of data, but none of it, to me, is convincing one way or the other. But so that I think that the proper diet is more important than probiotics. Fiber-rich diet is probably more important than probiotics. And I think that what you identifying here is exercise, sufficient sleep, and a proper diet really makes the difference. And those drugs that you take that allow you to have bowel movements are artificial, and if they help you have a bowel movement, it's okay. But it's not the real treatment. The real treatment is proper diet, fiber-rich foods, and what this says in this paragraph that you've itemized. Any other comment about it? Many of you suffer from constipation, so yeah, Daryl.
Yeah, some of the major things that kill good gut health, and we're talking about destroying the good gut bacteria, and that's what you're trying to overcome with probiotics. But eating processed foods, drinking too much alcohol, cigarettes, smoking, not getting enough exercise, not getting enough sleep, and too much stress, that all kills good gut bacteria. So if you take care of that, you may not need to correct it with probiotics.
Excellent point. Okay. Any other comment? Some of you out there suffering from constipation. Any comments or questions?
Yeah, I got a question. Would you say that diarrhea is the opposite of constipation?
Yes.
Okay, because the question is, um, we we've been focusing. It seems like we've been focusing more on constipation than we have on diarrhea.
Well, more people have constipation than diarrhea. That's why. And with diarrhea, uh, you lose fluid, and so replacement of fluid becomes critical with diarrhea. With constipation, it's the opposite effect. You don't move your bowels, so the toxins uh, multiply, and so that affects you adversely. With diarrhea, fluid replacement, for the most part, will correct that. And there are many things that can produce diarrhea, but I think far more common in the elderly group is constipation than diarrhea. And diarrhea is often associated with either medications or actual some disease entities.
The other thing, Dr. Callender, is that one of one of the things I'm thinking that help diarrhea is I'm not diarrhea, but constipation is drinking fluids. Is that correct?
No, drinking fluid, just drinking water, for example, does not, that should help the constipation. It should help it, not interfere with it. But I think the points that Darrell emphasized is probably where it's at. Fiber-rich foods, and then the balance. But drinking water does not cause constipation.
What I was saying is that drinking water will help with constipation.
Oh, yeah, that's true. Yeah, drinking water will help with constipation. But nothing helps more than fiber-rich foods. Water helps, yes, but fiber-rich foods and this balance that we emphasized. And I think Darrell's comments are critical. Yeah. Okay. Now this is a thing that John Buchanan has talked to us about for quite a while. Mineral sunscreens and what they have with them. They work fine in blocking ultraviolet rays, but they also propose other problems. This article talks about the other ingredients in chemical sunscreens that propose other chemical compounds which are dangerous to the body and dangerous to the seas. And this is something that is actually rarely discussed. And so this is an article that talks about why what they call boosters. And I think we are at the point now that we recognize that sunscreen is important to prevent against cancers. But we haven't gotten to the point that we have appreciated the difference between the different sunscreens and the fact that in addition to providing protection from sunscreen, they also produce other side effects which aren't so good. Buchanan, did you want to make any other comments about some of these sunscreens?
Yeah, I use now a sunscreen when I'm out on the boat over the ocean, because fishermen and boaters have a very high incidence of skin cancer because not just the direct sun, but also the reflected sun off of the water. And it's been recognized that a lot of the sunscreens had that oxybenzone that kills coral. So, I mean, but especially, swimmers at the beach, it's a really big deal there. But I wanted you to look at this picture. I'm going to put it back up here. This is the one that I use is by a company that specifically designed their sunscreen so that it would not affect the coral, but it makes you look like this, and this is a person of color, and I'm telling you look really weird when you put this on. I don't know. I you know I I don't like using it because it makes you look stupid underwater, but it's supposedly effective sunscreen and it's safe for the coral.
Interesting that skin cancer, squamous cell cancer is a malignant disease, and we don't get, as blacks, we don't get as much of that as we get. We talked about malignant melanoma last week, and that becomes even more of a problem because when you get it in blacks, it becomes more malignant. But so it is important to wear screens, but having the right sunscreen becomes important.
It's always better to look stupid than be laying in a box and have somebody tell you, doesn't he look good?
All right.
Okay, next one, please. Now, this is something that the World Health Organization and others are reminding people of our age group to be very careful because of not only the extreme weather, but then all of the wildfires that we have, and it worsens ventilation. And so, and talking about temperatures well above 100 degrees coming to DC shortly, as well as in Europe, it's been, they call it killer heat waves. You see that number, 61,000 people have died in heat waves last year in Europe alone. And they expect that figure to be higher in the United States because of the climbing temperatures. You know, when you talk about temperatures 127 degrees, like they have in Arizona and other places, it's frightening because what that means is if you don't have air conditioning, that means your risk of getting other problems becomes great.
Dr. Callender, I remember going across the Death Valley when I was a kid. We took a tour cross country. I think it was in '62, and we had roll down windows, you know, and my father said, "Well, we need to bring water," so we had a gallon of ice water, and we were pouring it on our feet. By the time we got to the other side of that desert, that whole gallon of ice water was gone, evaporated, and I think it was hotter than this 126. I heard some of the hottest temperatures on the planet have been like 136.
Well, yeah, wow. When it gets above 110, you know, wow, it's amazing what the body can stand. Okay, well, take advantage of your air conditioning and stay inside if you can.
I was just reading this morning where there's an Atlantic Ocean current called the AMOC, and that stands for Atlantic Meridional Overturning Circulation. That current is expected to die within the next 10 years. And what that current does is that it's responsible for making cold water sink to the bottom of the ocean. But there's been so much fresh water coming from melting of the polar ice caps that the fresh water, just by weight, is preventing the cold water from sinking as quickly. And so, what that means is for continental United States in the next 10 years, it's going to be hotter with many more storms. And the the heated water will not be going to Europe, which means that Europe will be more like an ice box. That current is responsible for keeping Europe warm because if you look at Paris, which has mild winters, Paris is further north than Montreal, which has frigid winters. But when that current dies, Europe is expected to have much colder winters than Canada currently does. So global warming is happening at the danger rate far faster than what was originally anticipated. Events that we thought were going to happen within 100 years are going to be happening within the next couple of decades. So you
Okay.
didn't know I was a meteorologist too. That's what I do in my spare time.
Daryl is an encyclopedia. Um, Now, this is an interesting article that talks about BMI. You know, we have felt that if you have a BMI that gives you in the overweight category, uh, that is associated with a higher mortality risk. Now, this article suggests that that is no longer the case for the overweight category. And there have been many articles recently that have suggested that BMI is just part of the story, not the whole story. And we know that over 30 is obesity, but that 25 to 30 group is overweight. And so I'm not sure that this is of benefit to make the people who are in the 25 to 30 BMI group feel comfortable about being overweight. But anyway, that's what this article is saying, that yes, the BMI of 30 and obese are associated with higher mortality, but the overweight group is not associated with higher mortality, which I think in many ways allows the overweight category of people to think it's okay to be overweight, when in point of fact, it isn't. And then the beat goes on because we talk about Asian folks who have lower BMIs and Black women who have higher BMIs. There's evidence that this is responsible and linked to increased mortality risks in Black Americans. Well, the bottom line is that, as far as I'm concerned, healthy BMI is probably the same. And if you're overweight, you still probably should want to be in the category of 25 and below. But and this points out that hypertension, hypercholesterolemia, and diabetes are associated with higher BMIs. We know that about 40% of people of color who are over 40 are overweight and obese. So there's room for us to lose weight for many reasons. BMI is part of it. And we also talked about the location of the fat being in the butt is associated with better health, whereas fat in the belly is associated with poor health. Um, any other comment about that article? Otherwise, we'll move to this one, which suggests that drinking more alcohol speeds up the progression of Alzheimer's disease. We are in the market of trying to find items that decrease the rapidity of the onset of Alzheimer's, decreasing it. But this points out that alcohol does just the opposite. We don't talk much about alcoholism anymore. And I guess one of the reasons is because we've legalized alcohol. Nicotine and alcohol are addictive, as is caffeine. But the association of diseases with alcohol and nicotine is even greater. So keep this in mind when you deal with your children and grandchildren, that there is an association between dementia and alcohol. Of course, recognizing that alcohol is an addiction, uh, one of the things that bothers me is that we say that 1 or 2 cups of alcohol is good for you, forgetting that 1 glass of alcohol in an alcoholic is devastating. And so that while a little wine is good for the stomach's sake, for those who actually are alcoholics, it's problematic. So so alcohol and genetic risk are 2 of the components that actually accelerate the possibility of Alzheimer's disease.
Dr. Callender, what are the benefits of a glass of wine periodic?
Well, they say that the benefit is that it improves your cardiovascular health. That's what the benefit is thought to be, in that so that they recommend it. 1 glass for women and 2 glasses for men. That's the basis for there, and of course the Bible says that as well. So it's interesting. But those who drink more than that certainly find that it becomes a great hazard, and it in itself may lead to memory loss. Now, this the question: does alcohol impact other forms of dementia? And I'm not sure we know the answer to that question. Although excess of alcohol is bad for all systems, especially the brain. So, and we know well about alcoholic dementia, which is a special disease. Any other comments on this? Do you have to deal with alcoholism in your families? Any of your families?
There's probably one in every family. I know that I know one that was in my family.
Yeah, my sister was an alcoholic, but she got saved and she got over that. So,
Hmm.
but I think you're probably right. It's at least one in every family. Yeah. Have they been helped by? We had one of our faculty was an alcoholic, and he got arrested for DUI, drinking under the influence of alcohol, and he had to speak to the rest of the faculty to acknowledge his problem, and so alcoholism is still a problem. Probably not, maybe not as evident as it used to be. Any other comments about alcoholism? Okay, this is an article that suggests that cannabis, among the other things it does, is that it affects the genetic profile. And epigenetics is a field that identifies the ways in which the gene can be changed by things that are outside of the body. And apparently, cannabis fits into this category. But the social determinants of health, we've identified that there are many things that affect the gene that have little to do with the genetic profile itself, but that the social determinants of health actually affect the gene profile and over time change the genetic profile. And so they talk about methylation and demethylation uh, by cannabis. Uh, there are many who believe that cannabis is one of the greatest drugs ever found because it's effective in reducing pain and causing anything that in some ways can be a stimulant and a depressant. But its impact upon the gene prior to this has not been emphasized. So, and the data that we have here are not remarkable, but are sufficient to identify that it does have an effect on the genetic profile.
Dr. Callender, this was not a part of Georgia Dunkson's study, was it?
No, no, our study didn't have anything to do with cannabis.
So it seems like going forward, she might want to include that.
Yeah, she might. You're right. And she discussed to us many times in social genomics, which is the fact that God speaks to us through our cellular profile. And this article is saying that cannabis impacts the genetic profile as well. But we haven't had a talk from her in a while. And it might be good to hear from her again.
I'm wondering how medical marijuana comes into play here.
Medical marijuana has been used for glaucoma and for pain. It has a benefit in people who have pain. So those are the two medical uses of marijuana that I know of.
And at the same time, they may be, lessening the pain, but increasing the genetic changes, right?
Well, I guess we need to have more studies to demonstrate the profundity of these effects on the genetic profile. You're right. And much of the role of cannabis in glaucoma has been replaced by other drugs, but its role in pain relief still remains something that many patients speak highly of. But you're right. There's so many things that affect the genetic profile. We just need to know about it. This is a study that identifies that vitamin D, while it didn't have an effect on the cardiovascular events, did have a slight help in cases of heart attacks and myocardial infarction. And this then is not the only reason for use of vitamin D, because we know that in vitamin D deficiency, it has a role. And it's been associated with a drop in the risk for coronary vascularization. So that then we know, of course, it's affecting patients who are on steroids, and they would become vitamin D deficient because of that. And so taking 50,000 units of vitamin D becomes important for these conditions that you see here. Hyperparathyroidism, renal disease, hyperparathyroidism, kidney stones, sarcoid patients are on steroids also. And so it does appear that there's some role for vitamin D in some of these cases, although there's not a huge amount of evidence, but it's enough to find statistical significance in the role of vitamin D in cardiovascular disease prevention. So I think we had many discussions about the role of vitamin D in people of color, and we haven't talked about that recently, but that discussion still goes on. Any of you take vitamin D?
Yes, I do.
I do. This is Sylvia. I do.
Yeah, because renal disease, actually, renal disease is associated with hypovitaminosis, and it has a benefit when you take the recommended doses, especially with osteoporosis uh, and associated with hypercalcemia. So there is a place for it. It's just that uh, if you're not vitamin deficient and you're not osteoporotic, taking doses above 50,000 international units can be hazardous.
Dr. Callender, earlier in the previous article, did it say that sarcoidosis is related to low vitamin D levels?
Yes,
Was
but
there a correlation between the two?
Yes, and one of the things that has to be borne is also the fact that many people who have sarcoidosis take steroids, and steroids makes you requires vitamin D supplements because it lowers vitamin D levels. But they are speaking of sarcoidosis in general. But I suspect that part of that is related to the fact that patients with sarcoidosis are often on steroids, which depletes the vitamin D level anyway as well.
I have sarcoid, and I was on steroid years ago, and but since I haven't been, but for years I've had a problem with the vitamin D level low counts. But in taking the supplements, eventually, and it took years, I finally have come up, not really high, but at least now I'm in the 30s.
Good.
So the doctor is satisfied, and I am too. Because
Good.
before, whatever we did, it just wouldn't move. But now it's much better.
Good. Okay. Now this article. Oh no. Oh, you went back to it. But okay. All right.
Oh, sarcoid.
Now go to the other one. You skipped one. Yes, this one. Now HRT means hormonal related replacement treatment, and there's evidence that even short term use is linked to dementia risk in women. And I included this one because you don't see much about this. And estrogen and progesterone are used for menopausal symptoms. And since there is a risk of Alzheimer's, this should be known. So it's important for those who take estrogen to at least be aware of it, the fact that it does increase the dementia risk. Now, one of the things that you have to keep in mind is that because there's a link, does not necessarily mean that there's a causation factor. We often put two and two together and come up with four, but that isn't always the case. But it's important to let people know that if you're taking hormone treatments, that there is an associate, twofold increased risk of dementia. Now, does this mean that if you have menopausal symptoms that you shouldn't take estrogen? No. Or progesterone? No. But it means you should be aware that there is a risk associated with it. Any comment from the women in the group who may take progesterone or estrogen? Now, this is interesting that those who take the vaginal estrogen treatment was not associated with the development of dementia, which is interesting. It's interesting. It showed that in young women, this was not the case, but in the older women, it was the case. Any comments? If not, it's just good to know, and also to do all the other things that are necessary to overcome the cognitive negative effects of progesterone and estrogen. Okay. Now this is a article that is causes a lot of thought, and I think it's pretty clear that engaging in oral sex, meaning cunnilingus, meaning men licking the clitoris of vagina, can lead to, because of HPV, to head and neck cancer. And I think that risk is clearly established. Of course, nobody wanted to say this, and they tend not to want to come out and say this, but this is suggestive. And so while cunnilingus is a practice that is well known and is part of the sexual act, it is still associated with HPV-associated oropharyngeal cancers. Now, is this surprising? Probably not, but it's certainly what percentage of sexual relations are associated with cunnilingus? That is rarely ever discussed, if at all. And is this enough to suggest that that it should be discontinued? I doubt if it did show that it would be discontinued anyway. But anyway, it's important to let people know that you see this 8.5 times more likely develop this cancer compared with those who did not practice oral sex.
So, Dr. Callender, we talked about this in a previous article, but we included throat cancer.
Well, that's what it is. Oropharyngeal cancer is throat cancer.
Yeah, but this article I thought was
head. No, it's head and neck cancers, oropharyngeal cancer, the same thing.
Okay.
Synonyms. So, any comment about this? Because it's something that is rarely discussed in medical. We know it medically speaking, but the lay public isn't as knowledgeable about what it means.
We have a hand raised.
Yes.
Is that John?
Oh, yes. I just wanted to check in with you guys, let you know I have not forgotten about you. I was in a hospital the last time we talked. I know it's off topic, but I come to clinic on Thursday morning, so that's why you haven't heard from me, because I'm at clinic every Thursday.
Wonderful.
Until I don't know when. And right now I'm here getting the stent removed. So I haven't forgotten about you guys, but whenever I'm freed up from a Thursday, I will be rejoining you guys.
Well, it's so good to hear from you. Glad things are
Just want
going
you guys
well
to
for
know.
you.
Okay.
Yeah, okay. Thanks,
Okay.
John.
You're
All right.
welcome. You're welcome. Okay, thanks.
So we got 3 Johns: Buchanan,
Yes.
Tatum, and Reynolds.
Yes. Yeah. Reynolds with the new kidney. Yes.
Yes, yes. Congratulations.
Thank you.
Yes.
Thank you.